Good morning, everybody. Myself, Dr. YUMNAM, will be speaking on the topic hypertension, attention for CSCR. I have no financial interest. Hypertension, uh, central serous choreo, excuse me, sir, it's not working. Central serous chorioretinopathy is an idiopathic disorder characterized by the localized serous detachment of the sensory retina at the macula secondary to the leakage from the choriocapillaries through one or more hyperpermeable RPE sites. It's more common between the age group of 20 to 50 years with male is to female ratio of 6:1. It presents in acute and chronic form. The use of steroids, psychological stress, renal dialysis, pregnancy, age, pylori vector infection are some of the risk factors. Hypertension is an important risk factor in developing systemic vascular disease and ocular vascular diseases. Hypertensive choroidopathy leads to breakdown of blood-retinal barrier in RPE, which leads to serous detachment and diffusion of subretinal fluid into the retinal tissue, causing retinal edema. Our aim is to study the association between hypertension and central serous chorioretinopathy or CSCR. It was an observational study which included all the patients of CSCR, both male and female of all age group, patients with known case of retinal diseases, diabetics, history of any trauma or intraocular surgery, and patients on any form of steroids were excluded. After satisfying inclusion and exclusion criteria, 40 cases of CSCR were included in the study. Informed consent was taken from every patient. A comprehensive ophthalmic examination was done, which included best corrected visual acuity, slit lamp examination, IOP, fundus examination, OCT macula, and fundus fluorescent angiography. Histories of pre-existing hypertension and newly diagnosed hypertension was taken. Blood pressure was recorded 2 times at an interval of 24 hours. Based on JNC7 classification, hypertension was classified as pre-hypertensive, stage 1, stage 2, and hypertensive emergency. Coming to the results, 92.5% were turned out to be male and 7.5% was female among 40 cases. And the mean age of the study population was 45 years, with majority of the study population belonging to 41 to 50 years of age. And according to JNC7 classification scale, 17 cases were normotensive, 10 were pre-hypertensive, 10 were stage 1, and 3 were stage 2 hypertensive. Here is a fundus picture and the FFA of a patient with CSCR, and OCT macula of a patient with bilateral CSCR. Coming to discussion, firstly, out of 40 cases of CSCR, 37 were male and 3 were female. A population-based study carried out in Olmsted County, Minnesota has also shown that male has 6 times more higher incidence than that of a woman. And secondly, the mean age in our study was 45 years, with the maximum study population belonging to the age group of 41 to 50 years. According to Gass et al. In his study, it also shows that the predominant involvement between the age group of 20 to 45 years. Thirdly, majority of the CSCR patient, that is 57.5 in this study, had elevated blood pressure. MF Karadak et al. Have also suggested that increased blood pressure variability could be a risk factor for development of CSCR. According to Ahmad Awashia also has published a study on bilateral simultaneous CSCR in a teenage girl with a history of systemic arterial hypertension. I would like to conclude by saying that hypertension could be a possible risk factor in the pathogenesis of CSCR. And it is predicted that prevalence of hypertension in 2025 to be increased by 24% in developing countries and 80% in developed countries. So early detection could prevent from progression of pre-hypertension to higher stages of hypertension. The diagnosis and follow-up of CSCR relies mostly on multimodal imaging. OCT opens a new window in evaluating the choroidal thickness as well as in follow-up. It is highly recommended to screen early and act early, as majority of these patients are young adult and are unaware of their hypertensive status. Their blood pressure must be checked, as hypertension not only causes ocular symptoms but also has systemic comorbidities. Early lifestyle modifications must be advised, which includes regular physical activities, low salt diet and fat diet, cutting down on alcohol, etc. And regular follow-up must be done. Thank you.